Gravity is great. It's Mother Nature's way of making sure you stay down to earth, keep your feet firmly planted on the ground, and stop you drifting away like a lost bullet. But because of gravity, if we sit down for a long period of time and your muscles aren't pumping blood up to the rest of the body, you start to get fluid retention down in the legs. Now we're at risk of discomfort, pressure injuries, and infections. Now, the way to prevent that is you can wear compression garments, you can keep your legs nice and active, or we can elevate the legs. Now, my grandmother, God bless her, she actually knitted me that blanket when I was a kid many years ago. I still use it to this day. She's amazing. But she has really swollen legs. So when she sits down at the end of the night, she puts her feet up because she says that's gonna help reduce the swelling of the legs. But I'm sorry, Sydney, that doesn't work. And I do tell her this. In order to get the fluid out of there, which is what's called venous return, you need to have the feet above the heart by about 30 centimeters. So what you need to do, you need to tilt the chair, maybe recline it, and elevate the legs to get that fluid back to the rest of the body. I know, it's a full-on position, but so is edema, so which is worse? And having your feet up can also help people with orthostatic hypotension. Now, if you don't know what that is, basically you get a little bit lightheaded, pretty common in spinal cord injuries because the blood's not going up to the rest of the body. So what you can do is you can tilt, but having the legs up makes that even better. And lastly, I personally have seen power elevated leg rest be really helpful for clients with tight quads, because if you've got your knee and it comes out a bit further and that's just your resting position, that's great, and we can accommodate that position, but now your chair is going to be quite long. So trying to navigate indoors is going to be really problematic. So what you can do is have the legs out to accommodate that position, but when we're trying to navigate through doorways and hallways, we can bring the legs in to make the chair a bit more compact and make it a bit more functional. You could also argue that having dynamic range in a leg rest can prevent contractures, but it's one small piece of the puzzle. Intervention like a standing program would be much more effective. But hey, that's my opinion. If you've seen power elevated leg rest be useful for one of your clients, let me know down in the chat. I swear I'll read it, I'll reply, it'll be good. Thanks, bye.